Next on Call, the value of exercise.
We all started talking about the Doing It Daily challenge.
And your chance to ask anything about health concerns.
Funding for this program is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Television.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, the Brookings Health System, Regional Health, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
There's the valve.
All of them together.
And which was healthier, the yogurt and the bagel?
All right, I'm going to start by measuring the size of it.
You could also add grilled chicken to this recipe.
Blow hard, blow, keep pushing.
Try to push your head.
Pull red handle to open bag.
Hello and welcome to On Call. I'm Tammy Watson. Well, our weather is warming up and we hope we've seen the worst of the cold and flu season, but it seems like there's always something to be worried about. Spring and summer bring their own set of medical issues. Things like insect bites and sun exposure pop up on our radar again. And of course, some medical concerns are always on our radar, things we may deal with every day like allergies and heart disease and arthritis. So we want to open up our phone lines tonight for another of our Ask Anything broadcasts. This way you can find out about the health concerns that are important in your life. And not only will your questions be the central focus of the show, but a little later you'll see a story about an interesting exercise challenge and learn what research says about mobile phone use and your health. So get ready to call in with your healthcare questions. Joining me in the studio live, ready to answer your questions, are Dr. Eric Murunga, Dr. Rebecca Vande, and On-Call Medical Editor Dr. Rick Holm. The phone number for you to call is 1-888-DOCTOR-ON-CALL. Again, that's 1-888-376-6225. And helping answer the phones tonight is a great group of volunteers from the South Dakota State University Pre-Professional Science Club. Dr. Holm, what's the hot topic in your practice right now? What's bringing people in to see you in the clinic?
I'm having a run of myelodysplastic syndrome, people who have bone marrows that are failing them or are turning to, they're thinking about turning to leukemia, that kind of a thing. I have a number of patients with congestive heart failure that are struggling, and I think, you know, there's recurrent pneumonias, and I have a significant amount of peripheral vascular disease patients with ulcers that don't want to quite heal. And, you know, I have a variety of very complicated, you know, new diabetics. I mean, you know, I take care of colds. There's colds that have been coming in, and I've got...
and you're ready to answer questions on any of this stuff tonight.
I just want you to know there's a run of complex things in my life. That's what's happening here. But, you know, this Ask Anything show is a special opportunity for you guys to call in and hit us with something that we don't know anything about. See if you can, I challenge you, can you catch us on something we're not aware of? We've got really sharp guests tonight. I'm pleased to introduce to you Dr. Eric Murunga and Dr. Becky Vande. Both Dr. Murunga and Vande are practicing at the Avera Medical Group in Brookings, partners of mine, partners in crime. So, Eric, tell us a little bit about you. First, you're an internal medicine doctor, a hospital and outpatient internist.
Yes.
And you're originally from where?
From Kenya.
From Kenya.
Yeah, that's East Africa.
East Africa. And then you went to medical school there, and then where did you go from there?
Yeah, so I did my medical school there, and from there I came to Sioux Falls, South Dakota, where I did a residency for 3 years. After that, I came here to Brookings.
So you've been in Brookings for?
Close to 4 years, maybe 3.5.
Woo.
Yeah.
So, and Bill Frieda, a classmate of mine, is a priest doctor in East Africa. And really, do you know Bill?
Yeah, not very well, but I've met him a few times. You know, he worked with a friend of mine, Dr. Karu, who's in Watertown now. So that's how I got to meet him.
All right. So, I mean, so it's funny that you would know somebody from Africa that I know that went to med school at USD at Stanford. So, Becky, you're a family physician.
Correct.
And you were originally from South Dakota, yes?
Yep. I grew up in Sioux Falls. Went away to Texas for college for 4 years, and came back and did med school at USD here in South Dakota, and went to Nebraska for residency, and then came back to Brookings.
And I went to church camp with your mother.
Yes, many years ago.
That's another great story. So, and you've been practicing in Brookings for how long?
I've been here almost 7 years.
7 years. So we have experienced doctors, and then I'm an old guy. I've been here 30. And so we'll put it together. We'll see if we can answer those questions, if we challenge you. We'll talk to you more about it right after this.
If you eat 100 calories a day more than your body needs, you will gain approximately 10 pounds per year.
Possibly one of the simplest things you can do to improve your health is to be more active. It's not news. We've known for a long time that regular exercise is part of staying healthy. But what we know is good for us and what we have honest intentions to do does not always jibe with how we actually behave. Finding the motivation to exercise on a regular basis can be a struggle. In our next story, you're going to meet a woman who found a way to make that struggle easier and to get a way to get friends and family involved in a challenge to stay active. Lynne Thompson is an RN case manager at the Brookings Health System. Her job, like many others, keeps her at a desk for part of the day. She likes to stay active, though, and has found that joining a group effort to get regular exercise has helped keep her motivated.
Well, a couple years ago, my cousin who lives in Yankton called me and asked me if I wanted to be a part of the Yankton Running Club's Doing It Daily Challenge, which was the simple rule was you had to walk, run, or bike 1 mile a day, 6 out of 7 days a week for a whole year.
Thompson didn't quite meet the goals of her 2008 challenge, but she found the experience very valuable.
This past Christmas, I was with my family in Sioux Falls, my mom and dad and my kids and my brother and his kids, and we all started talking about the Doing It Daily Challenge that we had done in 2008. So we decided to do it on our own. So it started with my family. We decided to start January 1st again, do it for a whole year. Everyone was going to throw in $20 to do it, and then whoever was left at the end of the year was going to split the pot.
Thompson bikes and runs on a regular basis, and by being part of a group with clear exercise goals, she gains an additional sense of community. This camaraderie came about in part by the fact that she and her family didn't keep their Doing It Daily exercise goal a secret.
We all started talking to friends and coworkers about it, and eventually we ended up with 37 people in our group who made a commitment to run, walk, or bike 1 mile a day, 6 out of 7 days a week for a whole year. And you are allowed to miss 1 extra time in a month and pay a $5 mulligan to do that. I was really impressed with some of the people taking on the challenge who were people who don't work out every day. I mean, they were really taking a step, trying something new for themselves.
You don't have to be training for a marathon to be part of Thompson's Doing It Daily Challenge, and there's flexibility in how to get that daily mile accomplished.
You know, our rule is 1 mile a day, but we can be very creative about how we get that mile in. I know I've spent 15 minutes at the very end of the day at 11:30 or at midnight marching in place for 15 minutes in front of the TV, or I've even run around my couch for 20 minutes late at night just to get that mile in. My daughter, with her 2 little kids at home, she runs up and down the stairs for 20 minutes, and the kids follow right along. So you can be creative about getting the mile in.
Doctors, there are a lot of exercise challenges out there, and we'll be mentioning some of them later in our show tonight. But first, Dr. Holm, I want to ask you about this one because you're actually involved in this one, right?
I put in my $20, and Lynne talked me into saying, you know, you work out 3 days a week. I know you do that. You need to do more. You need to do more every day. So I started walking to my study kitchen, Cook's Kitchen restaurant that is 6 blocks from my house. And 6 blocks back, that's 12 blocks. That's a mile. So I miss maybe a day every other week. And it has been a joy to do. I mean, I feel those days where I hadn't been exercising, now I've got that in. It's been a wonderful thing. And I'm encouraging people, and we're going to do a statewide challenge between family physicians and internists to see who can prescribe exercise more per capita, you know, if we can do it. And so we're asking people to go to Healthy South Dakota, healthysd.gov, and sign up and say, I was sent here by an internist, so that we can, you know, of course, if your doctor is an FP and she has sent you there. But we're looking to encourage people to get a mile a day, to do something every day. It makes your joints feel better. It makes your energy level increase. It helps you with your mind. And we're not talking weight loss. We're talking tuning up.
Well, how do you get patients to, what's your magic way of getting patients to get active? There's no magic way?
Eric, how successful are you at this?
Well, you know, what I tell them is it doesn't matter, you know, where you are right now in terms of your body, physical capacity. You can do something. It can be anything. And there's a good book that I got from the American College of Physicians. It's mostly a diabetes book, and you know, it talks about the diet and all these things. But there's a chapter there about exercise and anything. You know, some people just like dancing. So just, you know, there's a picture of someone with the headphones and just dance for 15, 20 minutes. That's the exercise for the day. Or just parking far away from where you're going. If you're going to Walmart, you take the farthest spot and then you walk. That's some exercise. Or, you know, somebody who can't even walk can take 2 cans of soda and just, you know, do some exercises with that. That's something. So anything. And, you know, a lot of people are doing that. Walking, of course, is one of the best forms of exercise. Just taking a walk, a few blocks, or as much as you can.
Yeah, Becky.
I encourage people to tell somebody that they're going to start an exercise program.
Oh, guilt
Yep.
works.
The accountability is huge. If somebody knows, they're going to hold you accountable to it, and you're more likely to stick with it if you've got other people that are looking out for you, or if you can find a partner, a buddy to be exercising with. That tends to be helpful. Again, somebody that's just going to call you in the morning, are we going today, are we going to do it? And it's a lot harder to say, you know, hit the snooze button than it is if somebody's calling you.
Okay. I encourage you know, if you've got a partner to walk with him or her and spend some time talking and put in 20 minutes with a brisk walk. If you think what happens in the end of a person's life, you know, the nursing home scenario, what happens when people are drawing an end, oftentimes the end part is compromised by their ability to be mobile. It's falling because they're not strong enough. They don't have mobility. It's a variety of things. And mobility is so important. And if you think about it, that walking, that mobility is enhanced by that walking. So, boy, would we like to encourage people to do that. And if you did it every day, you get into a habit, and you can work out heavy 3 days a week, but get that walk in. 20 minutes a day, or walk a mile a day.
Okay. Well, the questions are coming in, so we will dive in. A caller from Redfield, what are some of the symptoms of gallbladder problems?
Becky?
So,
gallbladder.
Common thing with gallbladder is going to be pain in the right upper abdomen. You know, often precipitated by a fatty meal. Some people will have nausea, but it's going to be typically that pain in that right upper abdomen. Sometimes it can radiate up into the shoulder. And usually after that meal.
Then what do I do if I figured out that it hurts here and it's probably
It's not always gallbladder, by the way. I mean, that's the classic picture, but the classic picture is not always the way it is. And sometimes it's gallbladder and it isn't the classic picture.
It is.
Eric.
Yeah, that's the thing. You know, when you get that pain, something that you're not comfortable with, you need to see a doctor about that, because if it's a gallbladder, it might be an emergency. So you might want to see somebody, go to the emergency room.
Okay.
That's what I'd say.
All right, thanks.
Flatus, floating feces, you know, you've heard these 40-ish, female. You know, there's all sorts of, you know, the 5 Fs, you know, that kind of a thing, but it's all different. I mean, in guys, I can remember a young 30-year-old buddy of mine when he developed gallbladder disease. We figured it out when we were racing across the lake, you know, on the motorboat. Boom, 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 and he's going, ow, 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 ow. So it's always different.
Okay. Changing gears again, female caller, do people ever overuse vitamins? Are there good ones to take? Are there ones that are bad for you?
Ooh.
And why should you take the ones that you should take?
You have opinions, either one of you.
There is a lot of opinion here, right?
Yeah, in the last few years we've had some research that shows most of the multivitamins don't do anything. In fact, some vitamins can actually be harmful. So you're better off getting your vitamins from fruits. If you eat fruits every day, that's the best source of vitamins, because there could be other things in there that we're not even aware of right now. Yeah. So as far as the good ones, fish oils, we know those work. Vitamin D, I know Dr. Holm has talked about that before. And you know, those two for sure are very, very, you know, we've got a lot of studies coming in showing the benefits.
Anybody who has a neuropathy, I'll add vitamin B12, because some people are deficient of that, and you can get too much. You cannot get too much.
Pills or shot?
It can be a shot if you're really low, and you know, the measurements are, you know, if I get a B12 level, it doesn't always mean that they're normal. You know what I mean? I don't trust the level. And people who have neuropathic problems, to include dementia, it can be B12 deficiency. So I'm pretty quick to throw B12 at them.
Okay, I better backtrack now. You've taught me that neuropathy is nerve pain, nerve damage.
Nerve pain, right? Nerve numbness, and the big nerve is this thing.
Yeah, okay.
So, but I think vitamin E's been disproven to be any help. There's a lot of data on calcium that's making me worried.
Yeah, we have
I'm dumping calcium like crazy.
We have another question from Huron.
Not sure yet.
A lady calling asking about, is it recommended to take calcium tablets?
Are you still recommending calcium at this point?
I haven't stopped recommending it. There is data coming out that says that, you know, maybe there is some increased risk of heart problems. So I'm on the fence with it right now. What are you doing?
Yeah, well, I'm still recommending it. Not, you know, because we still don't have, the guidelines still have not changed, even though studies are coming out showing maybe it's harmful to the health, but I guess we still need more studies there. A lot of people who drink enough milk probably don't need as much. Some people, I'm telling them, take maybe one calcium pill, sometimes with calcium, CalMag with magnesium, because they might get constipated with just plain calcium. So if you add the magnesium, it might do better for those kinds of people. Just one pill a day, and then a vitamin D tablet, especially postmenopausal women. The typical advice has been calcium with vitamin D, one pill twice a day. That's what I've been telling people all along until these studies started coming. I'm not taking them off that. We're still waiting for enough studies and change of guidelines.
Yeah. Well, I've dumped the guidelines. I'm off calcium, and I'm going 2,000 to 4,000 international units of vitamin D. It's the Institute of Medicine said 4,000 is safe. Under 4,000 is safe, and everybody should have it. And you know, we have to be conservative, so we're saying not 400 but 600 for everybody, unless you're old, and then it's 800. But that's only for bone, and they are not admitting that there's data about other things yet, because we don't have data. You know, we know that people who are low on vitamin D have higher risks. We just don't know if we give them vitamin D, it changes those risks. It's almost the same as cholesterol. High cholesterol, there's risks with it. Lowering it, we're not, you know, the proof in the pudding is not there, as far as I'm concerned. These guys will disagree, on before they've had heart disease. If they've got heart disease, it's another story. If they haven't had heart disease, you know, it's one of those, we don't know lowering cholesterol will make a difference. We don't know raising vitamin D will make a difference, but it makes sense to do it because we know the low levels or high levels carry with it risk. There's where I'm at.
You guys want to follow up on that, or you want to?
Blast away. Disagree.
Well, I do find with the vitamin D, I find that patients that have a lot of fatigue issues, if we can get their vitamin D levels up, it makes a really big difference. So that's been, I used to check thyroid and check for anemia, and when people are coming in fatigued, and now I've added vitamin D to my list, and that's made a huge difference for people.
Yeah, I've noticed that too. I had a guy who had a variety of weakness things, and this problem and that problem. He took the vitamin D and it went away. That isn't everybody's case, but
No.
certainly is anecdotally.
It's something to consider.
Can I just start popping them, or do I need to tell my doctor that I'm going to start taking these?
You're safe under 4,000.
Yeah. Okay. All right.
Eric, you okay with that?
Well, most people that you test, almost everybody is low.
They are.
Almost every, it's rare to get a normal vitamin D. I don't know, maybe because of the
lack of
low
sun.
sun and things like that. So, if somebody wants to take it without even being tested, I usually tell them, oh, you can take 1,000 a day. If we test it and it's low, then we might increase. We might even do the high dose prescriptions to begin with, and then go down to the over-the-counter. But I agree with you, very safe, especially below those numbers, 2,000 or 4,000. So.
Yeah, and I'll ask you this question. Yeah. So is vitamin D deficiency more commonly found in black people or white people?
Well, I really don't know that I've done or that I've come across studies with that tell us that, but just kind of trying to reason out, with the black skin, with the pigmentation, you probably won't absorb as much of the sunlight and the UV light, so you might actually be more deficient if you're black. But I don't know. Have you seen any studies? Or? Okay.
Yeah, you're right.
Yeah.
Oh, you were trying to stump him.
Yeah, I was. I knew the answer.
Well, with babies all along, we've like breastfed babies that are black. We've always supplemented them with vitamin D, and it's just been within the last few years that we've added that in for Caucasian babies, and that's because they aren't getting any from the sun.
Real quick before we change topics, folic acid for pregnant women, is that still something that's very recommended?
Yeah. Yes.
So that one is still
big.
1,000 micrograms a day.
Okay.
And I don't know that it's for anybody else except for those who are on methotrexate. But if you're pregnant or you're on methotrexate, folic acid, and otherwise it hasn't been shown to be of any help. And so the summary is I've dumped multiple vitamin, like Eric said. I've dumped calcium, like I've said. And I've added vitamin D, 2,000, and B12 if there's neuropathy. And I've been checking levels. And like you say, a lot of people are low in D.
But calcium's still plus minus.
See?
Okay, on that.
What? You mean I don't have all the answers?
You might be wrong.
On that, we will zip ahead. A question from Wessington Springs, female. What can she do for a Baker's cyst in the back of the knee? She's already had an anti-inflammatory shot. So what is a Baker's cyst, and what do you do about it?
All right, Becky.
Well, Baker's cyst, it's a painful cystic lesion that you can get basically behind the knee. It can happen from an injury, or it can just be spontaneous. And most of the time I'll use high-dose anti-inflammatory medications like naproxen or Aleve or ibuprofen. You can do compression if you put an ACE wrap on it. That can help. The steroid injection, and if it's not getting better, sometimes I've seen them surgically treated.
Okay. When I hear
and if they rupture, it can blast a huge inflammatory response in that lower leg, and it'll look like a deep venous thrombosis, or it might look like a ruptured Achilles tendon.
When I hear
so
cyst,
it's hard.
When I hear cyst, I think that it's something that can be
It's like
drained.
a ganglion cyst. It's an outpouching of the knee.
Can it be drained or not? Is that
I've never
doesn't
drained
work
one.
Okay, that's not an option there.
Any other comments about Baker's cyst?
Well, it's kind of connected to the knee joint itself. So if somebody has a lot of arthritis in that knee, they're probably more likely to get that Baker's cyst.
Yeah.
So some of those treatments that you'll do for arthritis, like draining the joint and injecting potassium and all these other things, are really going to help with that, unless, as you said, it requires surgery.
I like injecting steroids in people's knees. I mean, I think that we underdo that one. I mean, I have a great time. Hey, I think that it's something that we underdo in the elderly population, but it can be overdone. I mean, we can do it. It needs to be no more than, every 3 months or 4 months max in an elderly person. There's some risk to it.
Okay. Question from Parker, South Dakota. A gentleman has urinary pressure buildup in the penis, urinary infection 2 months ago. He used Flomax and it worked, but what should be done and what type of specialist should be seen?
Eric. Did you say he's elderly? Because
does not give an age on
because one of the things in men, urinary tract infections are not common. So, if a man gets a UTI, urinary tract infection, then that requires a little longer treatment. A lot of women can get by with just 3 days of antibiotics.
You can say the word antibiotic to the woman and it'll clear their urine. Amoxicillin! But not with the guy.
Yeah. Cranberry juice, a lot of water, treatment with antibiotics. If it's not getting better, then a urologist would be the person to take a look. Yeah. There could be more going on. It could be the prostate. It could be some other types of inflammation that are not really from an infection.
Okay, so if I'm a gentleman and I decide that I probably need to see a urologist, do I call the local clinic and ask them to refer me? How do I
start with your primary care doctor? I mean, go to your family physician, your internist, and present your symptoms, and maybe you don't need to go and wait another month or two to see the urologist who has a waiting, and you might be able to get the problem resolved, or maybe we need to schedule a quicker appointment because of a problem.
Okay. Question from Sioux Falls, gentleman age 64. What are some treatment options for Parkinsonism? Is that
Parkinson's disease? Eric.
Well, the diagnosis for that usually is challenging. With Parkinson's disease, there are a lot of people who have symptoms. They might think it's Parkinson's, it may not be, or they might think it's something else, and it turns out that all of them are from Parkinson's.
What types of symptoms?
A lot of times they might just be slow in their movement. They're not walking as fast. They don't even swing their arms when they walk. They just kind of have that gait that is, the arms are not swinging. And then the face, they might lose their expression. A lot of people, even the handwriting changes. They can't write as clearly, and it just seems to just drift off and trail away into a line. So that's one of the things those are some of the common things that you see. And then some people get tremors, and especially resting tremors. They're not, with the more common sorts of tremors, you get them when you're trying to do something. You're fine until you start trying to drink a glass of water, and then you're shaking. But with Parkinson's, you're just at rest, and then you get these tremors. And the treatments, a lot of times, the older kind of treatments are what we start on, and that's the levodopa, carbidopa. That's what we find that works for a lot of people, and typically that's what started. And if that doesn't work, then we might go to some of the newer ones. This requires a lot of monitoring, a lot of dose changes. Neurologists are frequently involved. So that's what I'd say.
A nice summary. I would agree.
Okay. Well, rapidly switching topics again, in our next news story, you're going to hear about mobile phone use. It continues to increase not only in the United States but worldwide. This has prompted some concerns regarding potential harmful effects from exposure to radio frequency signals emitted from these phones while in use. A new study finds that 50 minutes of cell phone exposure is associated with increased brain activity. Catherine Dolph explains in this week's JAMA report.
People and their cell phones. Today, they are almost everywhere you look. Phones provide instant communication, which most people seem to rely on.
I'd be lost. I can't live without it.
I use my phone all the time. I'm always on my phone.
It's kind of pretty much important to me because it's like my lifesaver.
I need my cell phone.
But what happens when we lift that phone to our ear? Can the radio frequency signals emitted from the phone affect our brain?
We really know relatively little about the potential effects that cell phone technologies may have on how the brain works.
To find out, Dr. Nora Volkow from the National Institute on Drug Abuse and co-authors studied 47 healthy people over 1 year. Participants had cell phones placed on their left and right ears. One cell phone was activated but muted for 50 minutes. The other was off. Then they were tested with both cell phones turned off. Researchers used sophisticated brain imaging to monitor the amount of glucose consumed in the brain.
It's a very sensitive marker to indicate if there are changes in brain activity that may be driven by a given stimulus, which in this case was the cell phone.
The study appears in JAMA, Journal of the American Medical Association.
50-minute exposure to a cell phone was associated with increases in glucose consumption by the brain, which indicates that the brain was being activated by the radio frequencies from the cell phone. This right area of the brain that was very close to the antenna showed the largest increases in metabolism as compared when the telephones were off. Even though the radio frequencies that are emitted from current cell phone technologies are very weak, they are able to activate the human brain to have an effect.
Researchers also say that those metabolic increases in the brain are secondary to the absorption of the radio frequency energy emitted by the cell phones. Catherine Dolph, The JAMA Report.
In 2009, 867 fatal car crashes were reported to have involved cell phones and distraction.
Thank you for joining us tonight. It's your chance to ask anything about healthcare. And here in the studio, ready to answer your questions, are Dr. Eric Murunga, Dr. Rebecca Vande, and the on-call medical editor. Doctors, real quick, I just want to follow up on that story we just saw about cell phones. We don't know what this means. The only thing we know about cell phones is really it can lead to distracted driving, which we know that's bad, right?
And probably we haven't said that enough. And who's guilty? Who's not guilty?
Let's not have a show of hands.
The point is that what we really need to do is to be responsible for ourselves and not take risks on the road and be distracted by our phones. I'm talking to myself.
I guess you guys see in the hospital the results of automobile accidents.
In the ER, we see people, and if you can prevent automobile, it's such a sudden, all of a sudden, everything's great. Oh, suddenly, bad things have occurred. And sometimes it's innocent people who weren't using their phone and they were in the line of fire. So the other question is, does the phone hurt your brain? And, the recent, the best that they have has not shown any increase in cancer of the brain. But, it all remains to be seen. I'm a little bit worried. There are these big waves coming in. I mean, do I have any data? No. Do I still use the phone way too much? Absolutely. Okay, now, I challenge the two of you to respond to that comment. Where are you with cell phones?
Maybe the teenagers are smarter than we all are because they text all the time.
Ah.
Maybe they know what they're doing.
As long as they're not driving.
As long as they're not driving, yep. They don't ever talk anymore. They just text, so.
It's a quicker conversation. Eric, what is your thought about it?
Yeah, I agree with that. We don't know much. Years back, we heard that they'll cause brain cancer, and all kinds of devices came up to protect that, which probably were just placebo. I don't know.
Okay. We don't have a lot of data. I have actual data. My right earlobe is thicker than my left earlobe, and it never used to be. And I think it's because I was on the phone one day jogging. I'm running up and down, and it got really hot, and I think I burned my cartilage, or maybe years of exposure to that bad radiation. Who knows? But my ear is thicker than the other ear. I don't know what it means.
All right, well, segue. We'll just move on. A question from Brandon, a female caller, and this one certainly stumps me, and I'm not the expert, though. Can you share information about Machado-Joseph's disease? I'm not familiar with...
Machado-Joseph's disease, Machado disease. You know what?
No, I guess that's the
answer.
Don't have the
answer. Do you have the answer, Eric? She got us.
All right.
Okay. She did, no. There
we'll all be looking it up after. That's like our homework assignment.
It's an odd. Yeah. It's an odd one, and
we'll get back to her on that.
We will.
We don't mean to make light of your call, but you got us on that. A question from Selby, a female caller, suffering from frequent urination and would like to know what she can do about it. So it's just she's got to go.
Frequency of urination. I mean, there's a whole broad.
Yeah, it depends on the age. Again, it could be a bladder infection. The common thing would be overactive bladder. The gotta go right now type of thing. And there are medications that can treat that.
That's a spastic bladder.
Yep, bladder just wants to work in overdrive.
What about the hypospastic bladder? The one that's just too flaccid that doesn't want to empty, and then it fills up and then it leaks and it squirts all the time.
I wouldn't want to have that.
No, that's another cause
of
problem. So there's two sides of it. There's too spastic, so you relax it. But if it's relaxed and it doesn't empty, the relaxing drugs that we use won't help.
What about exercises?
Well, the Kegels exercises. Eric, can you talk about that?
Yeah, those help a lot to strengthen the pelvic floor muscles, and there are different ways of doing it. There's some devices are used, like weights. Other times it's just maybe trying to control the urine flow. almost like, when somebody wants to go to the bathroom, probably hold it for a count of 5, and then let go a little bit, and then to a count of 10, and then just kind of build up like lifting weights. It's a muscle you're working out. So give it time, and that usually helps with certain kinds of conditions.
Back to that whole exercise thing.
Exercising the floor of your pelvis muscles. Becky, any comments about Kegels? How do you explain it to you?
I say, pretend you've got a ping pong ball in your vagina, and just and pretend you're squeezing your walls around that, and
I've never used that.
Well, yeah.
It's definitely, there's different ways to relate to anatomy.
So
we figured that out.
Okay, you say squeeze it around and hold it tight for 5 seconds.
Just pretend you're trying to hold that ping pong ball in there, hold it and relax, hold, relax. Do that 10 times when you're just sitting around doing nothing. And
anybody, any age, any adult woman, this is not a bad idea to do.
I've heard 200 times a day is the goal. I've read that.
And they can also, there is physical therapy that can, you can see a physical therapist and have formal physical therapy exercises that can help strengthen those pelvic floor muscles too. So a lot of women don't realize that. It's probably an underutilized resource that we've got.
Well, they say that it works 50% of the time if you use it. You just got to do it. It's the exercise.
Anything like that for men, or is that not?
No, it works for men. And I read where men who have rectal leakage or they have rectal problems, or even with bladder problems. If you practice tightening the floor of your pelvis, it's the rectum and the urinary thing, you just tighten it slowly, and then you hold it for 5 seconds, and you relax it, and you do that 200 times a day. I mean, you got to find a time when you can do it, when you're having lunch or when you're in the car, or whatever works. But 200 times a day is when you got to do it enough so the muscles get strong, and you've got to be daily doing it.
Okay. Changing gears, as is the theme tonight, a question from Sioux Falls. Should a person over 60 who has already had shingles still get the shingles vaccination? Yes, they're...
Absolutely.
Okay.
Simple answer. And I'm 60. Have I had mine yet? No, but I'm gonna get it. I've got to get it. I'm gonna get it. I was gonna get it last week. I'll get it this week.
Okay.
Next week, maybe.
So take shingles.
Soon. I need to do it.
All right. We'll check on you. We'll come back and check on you. A question from D. Smet, female caller. The couple has dry mouth at night and wonders what to do about it. They have the humidifier, which is up to 75 to 80%.
Ooh. I think that there's problems with the high humidity in a house because it'll raise bugs. I mean, you'll get the dust mites will thicken, and you'll have more problems with too many dust mites, and you may well end up with allergies, and as a result, stuffy nose and a dry mouth. I would say humidifiers. I used to promote a lot. I've cut it way back, and I've dumped using humidifiers over the last 10 years. You guys would have opinion that's bad. Mine's kind of off the cuff.
Well, I'd look at their medications, because medications are a common cause of dry mouth. So I'd want to check with your doctor and see if any of the medications could be causing that.
There's a disease, Eric. Dry mouth syndrome, Sika syndrome.
Yeah. Well, yeah. There's that, Sjogren's. All these things can cause a lot of dryness, but the pills are the most common. Antihistamines can do that. Some antidepressants, a lot of medications can do that, even diuretics. And the best thing is to check with their doctor and just find out in their list of meds, is there any that could be causing that?
And sometimes there's not a darn thing to do, and the only thing is lemon drops. You just suck on a lemon drop, and that's all you got, and they go, ooh, that's all you can have for me. That's it. That's as good as you get. You can go to the experts, and they'll give you lemon drops. Sugar-free lemon drops are better.
Oh yeah, otherwise you can get in trouble with your dentist, right?
Yeah.
Okay. Question from Jefferson, South Dakota, a female. For a teenage girl, what are some treatment options for psoriasis on the ankle?
Becky?
Steroid creams are going to be the most commonly used treatment for psoriasis. They can also do, there's certain types of light therapy that dermatologists can do. So those are going to be the most common things.
Psoriasis is an autoimmune disease that I can't catch from somebody. I have it or I don't have it.
Right, and you develop thick plaque-type lesions on really anywhere on the skin. It can be really difficult to control, and if you use steroid medications, it usually uses very high-dose steroids. But it's topical steroids, not oral steroids that we use.
Okay.
A tub of triamcinolone ointment is the same price as a tub of triamcinolone cream. And the only problem with the ointment, though, is you get a higher dose. But it will be more effective. And but I really, you know what I do with the psoriatic patients, they're just so tough. I just hand them over to the dermatologist because there's the guy, let him be the bad guy who doesn't have a good answer.
Does sun exposure seem to help?
Helps.
Does it? So
some people, psoriasis, I have a good friend who's got terrible psoriasis in his hands, but in the summer he just golfs all summer and it goes away. And then in the winter he gets back on the real powerful anti-psoriasis medication, which is...
Some will go to tanning beds, which is one of the few times that going to a tanning bed in small increments is probably an okay thing to be doing.
Yeah. Okay. Eric, you have any comment?
Well, with psoriasis, you want also to, you know, check with the doc, make sure there's no other manifestations. You know, it could be some arthritis that, you know, one might think is just osteoarthritis or the common wear and tear arthritis, but then it might be related and the treatment might be different.
Well, yeah, huge difference. If it's psoriatic arthritis, it can be a terrible disease, and it can respond to biologics. So psoriatic arthritis, it doesn't have to have much psoriasis to get the arthritis.
So if I'm a teenage girl, I'm totally freaked out right now. This sounds pretty stressful.
Yeah, yeah. But it might not be psoriasis. I mean, you know, you've got to make sure you've got the right diagnosis. A lot of funguses will look like this.
Yeah, what might look like
papulosquamous eruptions. I mean, there's just, it's, you know, dry skin, too much soap and water. Might be nothing more than that.
Yeah, okay. Eczema. It could be bad eczema.
Eczema.
Okay.
What is eczema?
Dry skin.
Yeah.
Oh, you
itchy, dry skin with an allergic base.
You said fungal infections. So I can just catch them from being in the school locker room and what?
You know, fungus is a funny deal, and because you know you think about it all the time and you never find it. Well, you see it on everybody's feet, but it never manifests any illness. I had a patient recently who presented with pneumonia, and despite all treatment, and this person had immunocompromised state, aged, lots of myelodysplastic syndrome, bone marrow depression. And she developed pneumonia, and I treated aggressively, added an antifungal just in case, and she deteriorated, and we sent her off to experts until, and then she died suddenly. And the autopsy showed fungus everywhere, in everything. So, you know, it didn't surprise me, but it surprised me. And did I cover it? I covered it. I could, if I had known for sure, I would have gone with the big gun antifungal drugs. But
when your immune system is that far
worn
out.
So we need. I think the fungus things, you know, we have to realize are there, but they're rare, and they don't occur in the healthy as a rule.
Okay.
Any comments, Eric?
Well, you know, fungus infections, they're very common. A lot of people might have them somewhere in your body, but it takes something else for it to come up. For example, yeast infections in the throat and elsewhere, you know, if you take antibiotics, that could happen. On the skin, you know, it might even be, you know, stressful situation or something, you know. Diabetic, all those.
Yeah.
Okay. All right, question, female caller from Watertown. Please discuss information about non-invasive aortic valve replacement.
Ooh.
So what is non-invasive aortic valve replacement? Everybody, don't talk
no. Eric, I've read some stuff, but
I had a patient one time who was not, because she had so many concurrent illnesses, she was not a candidate for the regular open heart surgery to replace her aortic valve, and she really needed a replacement. So when she went to the Mayo Clinic, they were actually doing a study on the non-invasive aortic valve replacement. So they were going to enroll her into a study and see if she was a candidate. So at that point, you know, this was something that they were going to do with, you know, instead of opening up the entire chest wall cavity, which would increase the risks of the surgery, they were going to try and do that just by going through smaller tubes and you know, making a smaller incision.
Like doing stents, only blowing up a new valve.
Exactly, and you know, so that's where I've come across it.
unfortunately, her condition was so advanced that she did not survive to the point where they were able to do that.
You and I were both at the national ACP meetings, and I stopped in on the cardiology presentation by the lady who's the editor of the Archives of Internal Medicine, and she reported on this study of where they looked. This must have been the study. I think it was a Mayo Clinic study, and it showed that it was very expensive. It was a very complicated scenario, and the results were just about like the open surgery, but there's some more complications, and so there's a place for it, but it's just it's a real but scenario.
Okay. All right.
And if you're a really complicated person who can't take the surgery, it might be the right thing to do, and certainly I would put it in the hands of the Mayo. That's the scenario for that kind of an institution.
Okay. We'll just change gears again, and a female caller from Sioux Falls, she's taking omeprazole for over 1 year for an ulcer, or metrazole. When trying to quit taking the medication, she suffers from severe heartburn. How can she get off the medication without suffering?
Taper.
So it's just
3 months. Takes you 3 months to get off that stuff. They did a study where you were. Tell us about it, Eric. The omeprazole. You've been trying to get people off of the antacid medicines and.
Yes, it's a useful medication, but it's one of those things that sometimes the symptoms that it treats are better with the medication, and when the offending reason why the problem came there in the first place is gone, then stopping the medication can make those symptoms flare up again. So you don't want to stop suddenly. It might not be that the problem may not have come back. It might be that stopping the medication is making you get the same symptoms. So it's a question of a very slow taper. If you're taking one, if you're taking one every day, you might want to skip every third day for a month, then skip every second day for a month, and just do it gradually in that way, talking with your doctor until you're able to go symptom-free. But there's a lot of benefit for that medication, especially in people who are at high risk of getting bleeding from the stomach if they're on medications that can cause that. There are some interactions with Plavix, which is a popular medication that is used to prevent stroke and to prevent heart attacks, or after a heart attack or a stent. So there's studies coming showing up that it might potentially reduce to a small degree the effectiveness of Plavix.
Becky?
I was going to say, if she had an ulcer, you want to make sure that she was adequately treated for that ulcer too. We know that you need antibiotic therapy if you've got an ulcer, because there's actually a bacteria that causes that. So
yeah, H. pylori.
She may want to be tested to make sure that they've eradicated that too.
Right, double treatment with an antibiotic for H. pylori.
Okay.
Great point.
Well, we don't have much time, so this is just a super quick question. But a caller from female was listening earlier, and she said she's on her feet most of the day. Does this count as daily walking? I guess it depends on if you're stuck standing still, or if you're. I don't like it too.
No, it is not enough. No, you're on your feet.
No,
you need to walk.
Okay.
And actually, the walking is so much different than just standing. So get your support hose if you're just going to stand all day. Make sure and get to walk. Do a walk to work. What do you think? Agreed.
I tell patients that for it to truly count as exercise, you need to break a sweat, you need to be short of breath, you need to be winded, and just your normal day-to-day walking that you do at your job, it's better than not walking, but it doesn't count as exercise.
Okay.
Yeah. You agree?
Absolutely.
Yep.
Okay. All right. Well, we've got about a minute apiece for each of you to wrap things up. Is there anything, Dr. Murunga, anything you want to share with the viewers that you want them to be thinking about for their health?
Nothing replaces exercise and diet. So those are the main things. A lot of times we try to use exercise to lose weight, but that does not work. For weight loss, it has to be just watch what you're eating, reduce the amounts, reduce those portions, eliminate the snacks, and by changing your diet that way, then the weight will come down. Exercise is great for the heart. Everybody should do some form of exercise.
Okay. Great. Dr. Reagan,
I'm going to stick along the same lines. We'll do the exercise and diet thing, but we'll look at kids. Parents don't realize what an impact they have, that their lifestyle has on their children. And we have this epidemic of obesity in this country, and a lot of it's because kids are not learning good eating behaviors. They're eating McDonald's, and they're eating junk food, and they don't have time for healthy meals because they're in so many activities. Parents really need to take ownership of that, and they need to make sure that their kids are eating healthy, well-balanced meals, get rid of the junk food, encourage physical activity, get rid of the video games and the TV, and we'll start raising healthier Americans if we can start doing those things from early childhood.
It's an epidemic. Get them outside to play.
Dr. Holm?
I think, how can you not talk about exercise? But I just think that a heavy person who doesn't lose, it's okay. Just get in shape. Thank you both so much for being with us.
Thanks for being with us tonight. Thank you for being with us tonight. Now stay tuned. We'll be right up with the Homespun Perspective and then what's new in medical science.
Looking for reliable healthcare information online? You can start with the resources link at the On-Call website. From there, you can access a variety of accurate and dependable information sources, including the South Dakota State Department of Health and Medline Plus.
Several months ago, the editor of a medical journal asked me to review a book written for an ethics course in a big city medical school entitled The Country Doctor Revisited. After finishing that review and while attending a national internal medicine meeting last month, a New Jersey friend referred to me as a country doctor who provides care to patients from the farm and small-town America. Well, growing up in South Dakota, I take the pastoral and countryside reference as correct, and certainly as a compliment. This week, a healthcare student finishing his 1-month stint with us complimented our clinic and hospital, saying not only were the medical and support staff warm and friendly, but this type of rural practice enhances patient continuity. By that he meant not only do we know the patient well from years of caring, but also when the patient becomes very ill, we provide for the care in the hospital, and then again in the follow-up at the clinic during recovery. He said this was truly giving the patient a medical home. I should add here that the patient-centered medical home is a buzzword now heard frequently in Washington. It's a concept which is supposed to increase quality, value, and continuity in healthcare by something we've been doing in smaller rural communities for a long time. But there is a downside to practicing here. It's not easy caring for people you know so well. You see them in church, at ball games, on the street, at the grocery store. Your patients are your friends. If something goes wrong or even a minor problem occurs, it's easy to feel the blame or to blame oneself. The upside, though, is that this accountability drives one to do his level best at all times to help the patient and not to do harm, to try and keep on top of all the honest scientific changes going on, to respect the choices of the patient, and to know then when to refer away to the specialist or when to keep them home. These ethical principles keep me grounded, allow me to sleep at night, and have helped me survive practicing in a small town. Guess it's part of being a country doctor. We'll be right back.
In our medical news tonight, I mentioned earlier that we were going to talk about some of the other healthy living challenges that are out there that you might want to get involved in. One of these is the President's Challenge Adult Fitness Test. It's the grown-up version of the President's Physical Fitness Test that you may remember from childhood. The adult test can help you determine just how fit you really are, and this is a good self-directed way of finding that out. There's a website with instructions. It's adultfitnesstest.org. Again, that's adultfitnesstest, all one word, .org. The President's Challenge is designed to inspire you to become more active, if this show hasn't accomplished that already. Once you've taken the fitness test, you can consider signing up for the Presidential Active Lifestyle Award or the Presidential Champions Challenge. That's for folks who are already on the move. And if you prefer to participate in a program closer to home, the Healthy South Dakota Initiative has the Move More Outdoors Challenge. You can sign up for it online at healthysd.gov, and you can join as an individual or as part of a team, and each participant will receive a pedometer to help track their physical activity. The Move More Outdoors Challenge runs from May 14th through June 30th, so you'll want to sign up before that May 14th starting date. And to do that, again, you can go to the healthysd.gov website. That's all the time we have for this evening. Remember, On Call is rebroadcast on SDPB Digital Channel 2, Mondays at 11 a.m. Central and Wednesdays at 4 p.m. Central. Once more, I'd like to thank our guests, Dr. Eric Murunga, Dr. Rebecca Vande, and our medical editor, Dr. Rick Holm. Thanks to our phone volunteers, and thanks to you for watching and calling in. Have a good evening.
Funding for this program is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Television.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, the Brookings Health System, Regional Health, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
To learn more about life and health, you can order your copy of The Picture of Health, a beautiful book containing insightful essays and evocative images by On-Call medical editor Dr. Rick Holm and Dr. Judith Peterson. This book, containing healthcare advice, stories of medical history, and meditations on healing, can now be yours for $17 at the South Dakota Ag Heritage Museum. Call 1-877-227-0015 to order. This offer is made by Ag Biocommunications at South Dakota State University.